Alright, before entering the room, I would check the patient's health records, get any assistance if I need it, and get my equipment. Hi, Mr. Smith. My name is Caitlin. I'm your student nurse today. Could you verify your name and date of birth? Alright, I'm gonna put on my gloves. I'm gonna check the ID band, make sure it's alright. So today we're going to be inserting a urinary catheter. Do you have any allergies to iodine or latex? No? Alright, so then I would go ahead and close the curtains. I have my field set up here. I already have the bed raised and my table here. I have my trash can ready down there. Alright. So first, I'm going to roll down, and we're going to start off with getting this pad underneath you. Now I would have assistance with putting the pad and holding the patient, but my assistance is recording, so this is what we're going to just have you roll over on your side. 1, 2, 3. And then here's my pad. Alright, we could roll back down. Alright. Just lie my pad down. And then I would go ahead and change my gloves and do hand hygiene before starting the perineal care. So we're going to roll this up. And then here I have my basin with my soapy water. And we're going to grab and go around. And then we're going to switch. We're going to go down to the side. Get the soapy water. Down the sides. Making sure to get it nice and clean. And then now I would have just my rinse water again around the top. Rinse water, the sides. Alright, and then I would, I'm going to go ahead and dispose of my gloves now. Or actually, I would, before disposing of my gloves, I would dry. So let's act like I have this glove on, but I would dry around and around. But yeah, that's what I would do. So now I would dispose of my gloves, put my towels in the soiled linen. I'm going to put this over here. Dispose of gloves, hand hygiene, and then now we're going to set up our sterile field. I'm going to use this for my cotton balls. Set it right there. Dispose of this. And we're going to set up on the side here.
Oh, yeah, you guys. Yeah, aspirate the water.
Let's put this on the side. Alright, so now I'm going to put on my sterile gloves. So now we're going to go ahead and start with this side. Set this up a little further down so that I can set my box in here. And then I could also get assistance for this as well, but we would drape this. That work out? Right in here, I'm going to place this here. And then they didn't say they were allergic to iodine, so I could pour on my cotton balls, making sure to fluff my cotton balls. Pour it on, and then we're done with this. Don't need that one. Lubricant. Alright. And then now I'm going to ready it. So we're gonna put the syringe on. I will dispose of that. And then now we're going to go ahead and we're going to take this hand and hold up. And we're going to take a cotton ball with the iodine on it and clean around. And then that means we're done with these two. That will later go on into the sharps container. We're going to take and lubricate it in our droplet lubricant. Alright, Mr. Smith, you're going to want to take a good couple deep breaths, and then I'm going to insert in about 3, 2, 1. And then I would look for urine coming back into the tube. And then we're going to insert to the Y. And here I will hold. And then now I'm going to pushing in the pop that off. I would dispose of the sharps, but I'm gonna hold on to this since we need it for removal of the catheter. I'm gonna give it, pull it back down so I can make resistance. Alright, so it's all set. So now I can clean up everything away from the field, dispose of everything in the trash, but again, that would go into the sharps, but I'm gonna set it off to the side for now. And then I would also take off trash, and then here I'm going to remove my gloves, hand hygiene, and then I would also remove this as well, but for sake of keeping my stuff together, I'll just leave it on there for right now. New gloves. Alright. Did you want any extra perineal care? No? Alright, and if they did, I would change my gloves again and all the fun stuff. Alright, so I'm going to scoot this to the side for now, and then we're going to attach it. So I'm going to have you. I'm going to make sure there's no kinks in the tubing and hook it up down. Alright, then I'll remove my gloves, hand hygiene, lower the bed, cover my patient back up, Mr. Smith back up, all the fun stuff. But now we're going to head into removal. So I have my check pad, I did hand hygiene, I put my gloves on. So I would first put a little tissue or a chucks down at the bottom and then my graduated cylinder to catch any urine so we can track it. And then I would check for the color, odor, clarity, and amount, and everything would be normal, nothing abnormal. And then here I'm I'm going to coil this up with the chucks that's under the patient already. And then here I'm going to set this aside, and then now I'm gonna grab my syringe so we can get the fluid out of the balloon and let pressure do its thing. And then we're looking for 10 milliliters since that's what went in. We want all that to come out. Doing okay. Alrighty. We're gonna pop it off and dispose of that in a proper place. And then, alright, so now Mr. Smith, I'm going to be taking it out. Go ahead and take a deep breath, and I will be pulling in 3, 2, 1. I'm coiling it in my hand. And then here I am wrapping it with the chuck pad. And then I would dispose of this in the proper waste bin. Okay, I'll just drop it in there. Now I'm going to remove my gloves. I'll put a clean pair on. We could take this off now too. Act like it wasn't there anyways, but. So then, yeah, so I would put a clean pair on. Did you want any perineal care? No, all right, if I did, I'd put new gloves, do hand hygiene. Then we would go ahead and cover them back up. Lower the bed, raise the side rails, give them the call light. And then, yeah.